Most of you probably know Facebook is dead. So, hey, we are. We're on YouTube. Hey, guys, I'm sorry you missed my intro there. I'll put it in a little bit later, but on the live podcast, the intro came through. I was reading some stuff on my screen. Um, yes, the new setup of my studio. Hopefully, you guys like it. As you can see, all my stuff in the background. Well, for those of you that are live on the podcast stream, you don't get to see all this wonderful stuff. And for those of you that are here on YouTube, well, if you're live with me, you're seeing it. But if you're not live with me, you're not seeing it. So most of you know Facebook is down. The world's coming to an end. People are freaking out, man. Well, I have my backup over here on YouTube. Thank goodness for YouTube. And yes, I came straight from work and did some updates on my notes to get ready for this show. And that's why I'm still in my work clothes. I'm still dressed for work pretty much. In fact, I didn't wear all my stuff to work today. I just realized I didn't have my name tag on. Um, well, guys, welcome to another episode of Amp Life Talk Radio, a show for amputees and those affected by limb loss. Um, I hope that, well, what I'll do later on, as I explain this to some of you, I'm going to get the show done early. So I'm a little bit early. I am going to do a live watch party. I'll post this up. That way you guys can see it as I'm sitting eating my dinner and spending time with the fam. I'll respond to some of your comments on here, but you'll get it over on Facebook once Facebook is back up. But for now, the show must go on. Welcome to another episode of Amp Life Talk Radio. For those of you on YouTube, you didn't really see the post that I did to promote tonight's show. A little background. I basically am on Facebook on a lot of social feeds for amputee support groups, and I see a lot of different things. So that's how I come up with some of these topics for my show. And tonight's show, if you know the title of it, it is TMR on Transtibial Amputees Reduces Initial Phantom Limb Pain. Yes, that is an actual medical article that I found, a write-up. I delved into a little bit deeper to come up with a quick show for tonight, because one of the biggest things I hear about with amputees in my job and what I see on social media a lot is pain. Pain is one of the biggest problems that I see with amputees who are out there trying to survive and get on with their lives while they're dealing with their amputation. This is new amputees. This also goes for amputees who have been amputees for some time, several years. They've been amputees, and pain is always a big part of what most amputees are talking about on social media. Now, an estimated 400,000 persons with amputations or who are amputated live in the United States. 400,000 persons live with amputated limbs in the United States, with approximately 60,000 lower limb amputations performed in the U.S. each year. Now, yes, I'm quite sure this number has changed quite a bit. It depends when this information was put out. But as you can see, the numbers are staggering for the amount of people that are dealing with limb loss. Although there's no medical test to diagnose phantom pain, doctors identify the condition based on your symptoms and the circumstances, such as a trauma surgery, well, we'll say trauma or just regular surgery, which occurred before the pain started. So that's kind of how, because most people are trauma or disease related, and if they are disease related, sometimes they are dealing with some type of pain. Trauma, of course, you're going to be dealing with pain because you were just in a trauma. We all struggle with this very real issue. Pain, phantom pain, residual limb pain. But tonight we're going to be talking more about the phantom pain and neuromas, the pain that comes from nerves. Regardless of the indication for your surgery, pain management after amputation is very challenging. Amputation of a limb is one of the most severe pains in the human experience. I know women will argue with that. They'll say giving birth is at the top of that list, but an amputation is probably right at the top of that list as far as pain on the human experience of what is considered painful. This is attributable to the magnitude of the tissue injury involved with an amputation. Pain after amputation involves neuroceptor or neuroceptive pain due to bone and tissue injury. A neuropathic pain from direct neural trauma and central sensitization. These are the types of pains and the reasons why you experience so much pain during an amputation. The receptors, the nerves in your limb that is being amputated are all being affected. The muscle tissue, the ligaments, everything is being pulled on, cut on, stretched. A lot of things go on during an amputation. The significant discomfort caused by neuroma and phantom limb pain interferes with the prosthetic use. And able to wear a prosthesis, pain really affects that. Subjecting amputees to additional physical and psychological morbidities associated with this chronic immobility. Although numerous neuroma treatments are out there, phantom pain, none of these methods are consistently effective in eliminating the symptoms of what we're going to be talking about tonight, which is pain in our residual limb, for whatever reason it may be, neuromas or phantom pain. Most amputees experience some pain after undergoing surgery, their amputation. It's part of the healing process and generally subsides, well, after your tissue starts to repair itself and is repaired. However, it's not that simple if you are recovering from an amputation to a limb, especially if you're diabetic and dealing with other comorbidities that are affecting your healing. After the initial post-surgical pain subsides, you may experience several types of sensations. Some painful and unpleasant, others strange and disconcerting. I always find it interesting when I talk with new amputees how when I get to this point in the conversation, if there's a family member or a friend there, and we bring up phantom pain, phantom limb sensation, it's always this weird look that they give to the other party, because I explain that, are you still feeling the foot that's there? Or are you still feeling that your foot's there even though it's amputated? And everybody's a little weird about saying yes to that with someone around, because it is really weird that people with limbs don't understand that we still feel our toes move, our fingers do stuff. We have an itch to the foot that is no longer there. All these different things that people don't really understand about amputation. After the initial surgical incision, um, and deeper tissue is healed, most amputees report sensations associated with the removed limb, such as what we just talked about: toes moving, itchiness, burning, cramping, all types of things that are going on with that limb that has now been removed that we don't feel too comfortable about talking about. We don't know how to say it to someone who is not an amputee or who is not going through what we're going through. Now, what we're talking about tonight, TMR and pain, phantom sensation, is one of the things that this TMR helps deal with. For those of you that are non-amputees, possibly healthcare givers, doctors, nurses that listen to the show, phantom sensation. Sometimes a patient feels that a removed body part is still there. That is sensation. Sensation is much different than pain. A person experiencing telescoping, how many of you amputees actually know what that means? Be curious to know by a show of hands. Telescoping has the feeling their missing limb is still there, but that it has shrunk to a very small size, similar to a collapsed telescope. There's no mention of pain with this common type of sensation, but uh, it's one of the things that it's unnerving to a new amputee to feel something such as this, because it's hard to describe to people who don't understand what's going on with you. Most patients experience phantom sensation of some sort within 6 months of an amputation. Some experience it right after the amputation, several weeks or a couple days. When we talk about phantom pain, that's a whole different beast. Phantom pain is exactly what it says: pain. Patients experiencing this sensation report an actual feeling of pain, raging from, or we'll say, ranging from mild to off the Richter scale. They always ask you, how is your pain? Is it a 1 or a 10? Phantom pain is exactly that. Sometimes it's a 1, sometimes it's a 10, sometimes it's a 5, sometimes it's a 2, it's a 3, but it's in the body part that's missing. And when it hits, man, you better hang on. If it's a really intense one, it can bring you to tears. Although amputation uh, or amputations have occurred throughout human history for God knows how long, phantom pain was first um, discovered and became clear um, by a Civil War physician. Yep, back in the Civil War, you could only imagine people were being blown up and missing body parts, and the things that they were going through at that time. This physician noted that as many as 90% of the soldiers with limb loss attempted or amputated during wartime developed some degree of phantom pain. Thanks to the advances in modern technology and medicine, phantom pain has fewer effects now today on people. But about 60 to 70% of patients still feel some type of phantom pain. Residual limb pain. This type of pain occurs in the part of the limb that is left behind, often referred to as the stump or residual limb. I know some people out there like to name theirs, but the amputated limb is where residual limb pain occurs. After the amputation, you will experience one of these three, maybe all three at the same time. At the amputation site, some people develop something called neuromas. I see a lot of posts on Facebook talking about pains. I see a lot of people asking the questions about what's going on with their pain and their residual limb. It's hard for me to answer some of those questions in that type of setting because it's not a simple yes or no question. It's not a simple one sentence. Um, it's not like Twitter, 140 characters, and boom, I've got you an answer. It goes way, way beyond that, as we'll see later in the show. So, if you have developed some type of neuroma, well, first, most people, I think, from what I see, they don't even know what a neuroma is. So, let's cover that first. This occurs when a cut nerve ending forms a tiny little ball on its end during healing or gets somehow trapped in the suture line when the surgeon is basically suturing up, closing your incision line. This is not phantom pain, so don't mistake the two. But pain originating from the stump, you will feel that. And I think a lot of people diagnose or mislabel the different pains they're having. A poorly fitting prosthetic device or limb bruising can cause residual limb pain as well. We're talking about people who are new amputees and people who have been amputees for a while experiencing pain. That's why it's deeper than a chat on Facebook to try and discern what type of pain you're having and if you actually have a neuroma, if it's residual limb pain or phantom pain. It's really hard. And I typically don't get involved in those discussions. I'll ask sometimes to move it to a private inbox so I can better figure out more information to try and help a patient. But it's really hard to try and have those discussions on Facebook, when everybody's throwing out all these different things that they think is going on. Losing a limb due to trauma, cancer, or poor circulation can result in phantom limb and stump pain. Some studies show into up to 75% of amputees in the United States. So basically, if you have lost a limb, no matter for what reason, trauma, cancer, poor circulation, you suffered an amputation, 75% of those people experience some type of pain in their limb. Now, the purpose of our talk tonight is to talk about this new procedure that I stumbled across and found called targeted muscle reinnervation, TMR. It is a surgical procedure involving the transfer of residual peripheral nerves to the redundant target muscle motor nerves, restoring physiological continuity and encouraging organization of the nerves to nerve regeneration to decrease and potentially prevent the chaotic and craziness and misdirected nerve growth, which can contribute to pain experienced within the residual limb. So, in short, what they're basically doing with TMR, the rerouting of nerves cut during your amputation into surrounding muscle greatly reduces phantom pain or phantom limb and residual limb pain. Instead of just leaving those, I've tried to explain it this way to most people when we talk about phantom pain. You have your nerves or pathways, and imagine them being freeways. And then all of a sudden, that freeway's cut off, and people are still trying to get down that freeway to where they need to go. Well, as we know, people get road rage when they can't get to where they want to go. So that's what's kind of what's happening with your nerves, man. Road rage, those signals and that electric current is not getting to where it needs to go, and it's causing road rage in your residual limb pain. Um, that's one way to look at it. Those signals need somewhere to go, and through this TMR, uh, they're basically reconnecting those nerves into muscles, which gives the nerves something to do because now they're thinking, okay, I'm connected back to this foot or to the limb that was amputated. And what they have found is that this helps reduce greatly phantom limb and residual limb pain. Most of you, I don't know, you probably never heard of this. I found it while doing some research on pain this morning for what I was going to talk about. TMR was first developed to allow amputees better control of upper limb prosthetics. Traditionally, doctors perform the surgery months or years after the initial amputation when surgeons discovered this procedure also improves certain causes of pain in amputees. They started using it to treat disorganization of nerves. The nerve endings that were disorganized during your amputation, meaning they were cut and just left there, they started to use this to organize those in some fashion to go into the muscles. This disorganization of the nerve endings, called symptomatic neuromas or phantom limb pain, that's what they discovered. Those nerve endings that were disorganized and just left out there, this led to neuromas, phantom limb pain. You leave a nerve hanging out there, it gets stitched up in your incision line. You leave a nerve ending out there, and that nerve has nowhere to send signals, causes phantom limb pain, phantom pain. Doctors have found that this surgery to reroute the amputated nerves, called again TMR, targeted muscle reinnervation, because I know you're going to want to ask your doctor about it, um, can reduce or prevent phantom or residual limb pain from ever even occurring in amputee patients who receive the procedure at the time of their amputation. So I know a lot of you are going to throw this out to your doctors um, if you are due to get an amputation. And that's one of the reasons I wanted to talk about this, is because this is such a big topic on the social media pages that I see. Pain and the types of pain people are experiencing, most of them have to deal with nerve endings. The people, well, we'll say the physicians who discovered this are at Ohio State University, Wexner Medical Center, College of Medicine. Look it up online, read a little bit more on it if you wanted to possibly talk about this with your surgeon if you're about to get an amputation, and get their thoughts. They are currently uh, pioneering the use of this procedure, TMR, to prevent or reduce, uh, as we most know, for some people, it's a debilitating, crippling um, situation with phantom pain and residual limb pain in individuals with transtibial amputations. Remember, transtibial amputations, that's below the knee amputations. Um, some of the things that I found was that the surgeons performed this on 22 people, or they performed 22 of these surgeries on patients with transtibial amputations during a 3-year time period. None of those patients has developed systematic neuromas, and 13% of the patients who received the procedure reported having pain 6 months later. Those are pretty good numbers, if you ask me. It's worth looking into. It's worth uh, doing your research on. So why I'm bringing it up to you now. A significant amount of pain is caused by, for those of you that don't know, when I see you talking on Facebook, a significant amount of your pain in some of these posts that I see where people are talking about residual limb and phantom limb pain is caused by the disorganization of nerve endings. If your nerves are cut and just left there, a lot has been discovered on what those nerves get up to just by being left hanging out there. Uh, they form these neuromas. They form when the nerves are severed and not addressed. I mean, just cut and left there. Um, Basically, they have nowhere to go. You just have nerves just dangling in your in your residual limb. And what they're saying is attaching these cut nerve endings to muscle allows the body to reestablish some type of neural circuitry. Um, this alleviates phantom pain and phantom or residual limb pain by giving those nerves something to do, giving them a purpose, giving them somewhere to go, something to do, rather than just being there, cut, severed, nowhere to go. That signal just ends and it kind of just sets your body into a spin. Patients who have had this procedure, uh, like I said before, significantly show a reduce or reduction, sometimes no pain at all with these phantom pains and phantom limb pains and neuromas. Why is that good? I'll tell you why that is good. Because if you are a sufferer, if you're suffering from this type of pain, you're going to be able to stop using narcotics and other nerve pain related medications. That's a good thing. This is worth your time to look into to see if this may potentially help you. The procedure has been shown to reduce pain scores in multiple types of pain uh, in amputees, validating um, the study and surveys that these doctors have put forward. These findings are, again, this is new. These findings are the first steps to show surgery can actually greatly reduce phantom pain and other types of pain directly. So check it out. TMR. TMR represents one of the most promising treatments for neuroma pain and phantom pain. Um, I want to say to you guys, it's something that it's new, but it is well worth looking into. Um, if you are how can I say, if you're an amputee and you're dealing with uh, mass amounts of pain from phantom pain that is causing you to lose sleep, take excessive drugs and medications, TMR is one of those things that you definitely want to look at. Um, when done at the time of the initial amputation, that is the most important thing to remember. There is a minimal health risk, and recovery time is similar to that of a normal or traditional amputation surgery. So there's not a lot of risk involved with this if you decide to pursue this, talk to your doctor about it, and go down that road. I'm going to be wrapping up the show, but I want to talk about one thing that I see on Facebook a lot. And I'm going to do that right after this quick little break that I'm going to take and get me a sip of coffee because it's been a long day, boys and girls. So I'll be right back to wrap up the show. I always love it when you queue up something and it pauses right in between. Well, that's live streaming, folks. That's live streaming. I have found that there's not much you can do about that other than just let it roll, man. And for those of you out there in YouTube land, my apologies, but sometimes that's what happens when you're doing a live show. I don't do pre-recorded stuff around here that much. So you're getting it as it's being played live. Now, we wanted to talk about some things that I see. I see amputees posting all the time on Facebook and social media uh, support pages about their pain. What to do about it? Is this normal? Unfortunately, the information is coming from other amputees. Some may have the right advice or information, but it's a gamble. If you suspect pain in your residual limb, phantom pain, neuroma pain, um, that is not normal for you and it's becoming an issue, here's what I suggest: diagnosis. And I had this discussion with a young lady briefly on one of the pages the other day. And I basically gave her the advice that I'm about to give you. It is important to be or to get an accurate diagnosis and identify the cause of your residual limb pain or your phantom limb pain. We'll stick with more of the residual limb pain. You're having pain in your residual limb. We don't know what type of pain it is. So we can't necessarily say phantom pain. So remember that when you're looking at these posts, people are talking phantom pain, but I think a lot of times they're just talking about pain in the residual limb. Well, we have to figure out what type of pain and what's causing that pain. So, as in some causes, this may be reversible. Uh, tests and procedures used to diagnose residual limb pain may include a physical exam. That's why I have said if you have doubts, go to a doctor. Your doctor will likely suspect or inspect your residual limb and feel it to check for skin breakdown, pressure sores, and problems with the bone. That was the young lady's question the other day about her bone. Um, they will also look for signs of infection and masses. Your doctor may also tap on the very bottom of your residual limb to check for symptoms of pain that indicate a tangled uh, nerve ending that can form after your amputation, neuromas. Imaging tests, MRIs, CT scans, X rays, or ultrasounds may be used to help rule out other possible causes for your pain. To confirm the doctor's suspicion, these tests may identify fractures, bone bruises, and other bone abnormalities, tumors, and infections. Next and last, blood tests. You may need to get some blood tests to help rule out other possible causes for your pain or to confirm your doctor's suspicion. So don't be surprised if you have pain and you want to know what's going on, go get a diagnosis from your doctor. That's the best thing. We see this a lot with prosthetics. People come in and complain that the prosthetic is actually hurting them when in actuality the prosthetic is fine. Uh, then we will suggest you need to go meet with your doctor and get some tests ran. Come back with those results, and then we'll go from there. But a lot of times when amputees who have prosthetics, they want to blame the prosthetic instead of going to your doctor and getting these simple things ruled out first before you declare that your prosthetic is not doing what it needs to be doing. And if you're hearing beeping, that's my computer. I get stuff sent to me while I'm online, unfortunately. Um, but please do that if you suspect some type of pain in your residual limb. Go through those simple things: physical exam, imaging testing, MRI, CT scans, X-rays, ultrasound, and then last but not least, some type of blood test if the doctor suspects something. In conclusion, what I would like to say, boys and girls, all my fellow amputees out there. TMR has the potential to treat pain from the romas while enabling amputee patients to return to their active daily living, improve prosthetic use, uh, which is really big for us amputees. We want to be able to improve that prosthetic use, um, and make sure that we're getting the most out of life, the most out of our prosthesis. It will help improve not only your prosthetic use, but some of the tolerance being in a prosthesis, because it does put a lot of pressure on the residual limb. And if those nerve endings are just left there unattached, that can become very uncomfortable. Recent research in this area is relatively new. I mean, all these things that these doctors are discovering on a daily basis while looking for other things are leading them down this road to help us deal with some of these things that we thought that there would never actually be any remedy for. And I think the TMR procedure is worth looking at as it aims to optimize the efficiency and or the um, effectiveness and efficiency, and um, help us uh, demonstrate that with science and technology, there's a lot of things that we can do and set standards a lot higher for the care of amputees. So please, if you have questions, I would say definitely research TMR, talk about it with your doctor. If you're having some type of pain in your limb, go through the steps that I just talked to you about with diagnosing that pain with your doctor, and try and get that figured out, because it's not fun being in pain. Um, I think that this procedure will provide the blueprint for improving patient outcomes and the quality of life following amputation for many amputees out there. So please look into it. I know tonight was not a really long show, but I just felt the need to really put that out there as some good information for you to look into, as I see so many of you suffering with pain. I thought that would probably be a really good topic to just bring up and have a quick discussion on. Well, folks, that's the end of the show. I want to thank you. And yes, for those of you that don't know, and I'm quite sure many of you do know, Facebook is down and out. So I'm over here on YouTube trying to put together a quick video so that we can still get this up. If Facebook does come back up at some point in time during the night, I'll try and post this up. If not, look for it tomorrow or in the morning. I appreciate all of you. I want to say thanks for always tuning into the show. I know I don't do a lot over here on YouTube, mostly because of copyright issues. I have permission to use certain musics, and they keep trying to tell me that I don't. So, YouTube, you need to get your stuff together. I wouldn't use copyright music. I keep telling them that the band's my friend, but they keep telling me that I'm stealing people's music. Um, Other than that, check me out on Facebook, Instagram, Twitter. Show me some love on either one of those pages. And guys, hey, yes, we have some cool things coming up. We're going to have the talk show edition to Amp Life Talk Radio, which is Amp One Studio. So be sure to go over on Blog Talk Radio and punch in Amp One Studio and save our page, register so that you can communicate with me back and forth. And make sure you write down the call-in number because I have posted it. We also have something else over on our main page, which is amplifetalkradio.com. You can help become a sponsor of the show because I don't take on sponsors, and I have talked with many people about being sponsors, but the problem with that is um, sponsors want to change your show. And for me, I like having control of my show so that I can bring you all this amazing, wonderful content without having someone trying to dictate what we talk about and bring to you. So if you want to be a sponsor and get your name on the brick wall, the Amp Nation Hall of Fame brick wall, go over there and check on that. Click on the link. It'll show you the donation amounts, but you will get some pretty cool stuff if you become a sponsor of the podcast, Amp Life Talk Radio, Amp One Studio. Uh, I'm looking to keep this going, make it better. And if you become a sponsor, just look at your category and you'll see the wonderful gifts that I have in store for you once you become a sponsor of the show. Get your name up on that brick wall, people. Um, I'm looking forward to the first few people getting their names on the wall so I can post that. And every time we get a sponsor and you're up there, your name goes on the wall. So I appreciate it. I appreciate all your support. I appreciate everyone tuning in all the time, listening to us. I'm so thankful. And um, if you're out there in the Northern California area and you want to be involved with a support group, or we'll say being a peer mentor or a peer visitor, I am actually the AMP Power coordinator of Northern California. So AMP Power, um, reach out to me on my page if you would like to be trained and certified as an Empower mentor or peer visitor. You know how to get at me on Facebook. Reach out to me, shoot me a message. I'm going to be setting up a training here pretty soon. Other than that, people, I appreciate you all. I love you all. And I'm so thankful that each and every one of you tune in every show and make this show such a wonderful show. I want to say thanks again for tuning in to Amp Life Talk Radio. Amp One Studios, the live call-in show is coming soon. Make sure you go over there and add us to all the pages. Everyone, take care and have a wonderful night.